So let us start our discussion here first with this posterior abdominal wall where I can see the lumbar plexus here. Now, how will you identify the branches from the lumbar plexus? Where is femoral nerve? Where is obturator nerve? Where is genitofemoral nerve? And that can be done on the basis of certain muscles. There are a few muscles that you can see here, the psoas muscle, the iliacus muscle. Now, once you understand these muscles, and then it is easy for you to get oriented to the nerves also, which are coming out from the lumbar plexus. Now guys, first of all, let's mark these muscles. Now this muscle that I'm pointing at right now, this muscle here is a psoas major muscle, and the one which you see on the psoas major muscle is psoas minor. Minor is not always present, but if it is there, it will be overlapping the psoas major. The major is the important muscle here, the psoas major here. So this muscle, I'll just try to find out this place to write them. This is the psoas major. The muscle that you can see on the iliac fossa, guys, this muscle here is iliacus. There's muscle on the iliac fossa, that is iliacus. And then above the iliac crest, above the iliac crest, you see the two muscles here, this one and this one. This is quadratus lumborum. How about I label these muscle on this side? This muscle here is quadratus lumborum. And this muscle, which is next to the quadratus lumborum, is transverse abdominis. It's the muscle of the anterior abdominal wall, starting all the way from posterior side. It's coming from the thoracolumbar fascia. So it's the transverse abdominis muscle will be coming from the back and will be in front. So these three muscles, I'll tell you something, these three muscles are also forming the posterior relation of kidney as well. Now, if you have these slides with you, don't draw it. I'm just telling you guys, kidney will be present somewhat like this. That's how the kidney will be there, relatively in that region here. So the three muscles that lie in the posterior relation of kidney is psoas major, is quadratus lumborum, and transverse abdominis muscle in that sequence. How will you identify the nerves? The main motive here is to identification of the nerves that you see here, the nerves coming from lumbar plexus. See, the main muscle here is psoas major. Your identification is mainly relying on this muscle, the psoas major muscle. The nerve that you see which is piercing the psoas major muscle and coming out, guys, this nerve is the genitofemoral nerve. As I said, the only thing that we got to understand here is the identification of the nerve. If it is an image based question, they will ask you to identify these nerves. In the last exam only, they asked a question in the last NEET about the psoas abscess. It was a radiological question, but if you know the shape of psoas major muscle, iliacus muscle, you can easily make out that how the psoas abscess will look like. So that's a genitofemoral nerve which is piercing the psoas major muscle. Now you will see a nerve coming out medial to the psoas major and running on the ala of the sacrum, guys. That over there is the ala of the sacrum. That's the ala of the sacrum, and this nerve which is coming out just medial to psoas major is obturator nerve. This here is the obturator nerve. It's the main nerve supplying the medial compartment of thigh, and that obturator nerve is just coming out medial to the psoas major. Lateral to psoas major, the nerve which is not shown in this picture here, the lateral to psoas major muscle is this one, guys. Look at that. That nerve is a femoral nerve. If this is obturator nerve here, that big nerve that you see here is the femoral nerve. So I'm going to draw it for you. The femoral nerve, they have not shown it because the view is a little different here, but the femoral nerve, if we need to draw it here, the femoral nerve emerges out like this. So femoral nerve will be seen emerging out between the psoas major and the iliacus muscle. That's femoral. So on the basis of the psoas major only, these three nerves can be identified. If you see medial to psoas major, it is obturator. If you see piercing the psoas major, it is genitofemoral, and immediately lateral to psoas major, or you can say between psoas major and iliacus, that is the femoral nerve. The trunk of femoral nerve will be there. Now look at another nerve that I see here, which is running within the iliac fossa. This nerve is running within the iliac fossa, and then it is piercing the inguinal ligament to come out and supply the skin of the thigh. This nerve, guys, this nerve here is lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh, which can be compressed deep to the inguinal ligament and can cause meralgia paresthetica. So that's the lateral cutaneous nerve of thigh. Remember how to find out the lateral cutaneous nerve of thigh? You will see the nerve coming out from deep to the psoas major and then running within the iliac fossa. You will see this nerve running on the iliacus muscle. It runs on the iliacus muscle, will come into the iliac fossa front and then pierces the inguinal ligament to go out. Then the another two nerve that you see, this one and this one, both are coming from L1, and the one above is the iliohypogastric nerve, and the one below here is ilioinguinal nerve. Iliohypogastric and ilioinguinal nerve. You can see the ilioinguinal nerve is in close relation to the iliac crest, not in the iliac fossa but relation to the iliac crest, and the one just above it is iliohypogastric nerve. And finally, the one more nerve that you will see here, which is coming out deep to this arcuate ligament. There is an arcuate. Diaphragm is having these arcuate ligaments. This arcuate ligament is lateral. That's a lateral arcuate ligament of the diaphragm, and deep to the lateral arcuate ligament of the diaphragm, this is the subcostal nerve, guys. Subcostal nerve, right? What is subcostal nerve? The T12. The nerve which is running below the 12th rib, that subcostal nerve will be seen just below, emerging below the lateral arcuate ligament. So there is a hint for everything here. Femoral nerve, lateral to psoas major, between psoas major and iliacus. Genitofemoral nerve, piercing the psoas major coming out. Obturator nerve, running on the ala of the sacrum, medial to psoas major. Lateral cutaneous nerve thigh, running within the iliac fossa on the iliacus muscle. Iliohypogastric, ilioinguinal. The one above is iliohypogastric, the one which is below and running along with the iliac crest and then will obviously go into the inguinal canal also, that is ilioinguinal nerve. And the one that you see coming out deep to the lateral arcuate ligament is the subcostal nerve. Now, just for your information, guys, out of all these, because although it's a branches from the lumbar plexus here, the one which are vulnerable to injury in the surgeries of the kidney are the nerve which are present behind the kidney here. So the nerve which are in posterior relation of kidney will be these. Now if you look at this, I'm just putting it very carefully here because not every nerve is there in the posterior relation. Look at that. Look at the three nerve which I covered inside, guys. I'm just let me draw that kidney in there. This is the kidney here. And these are the structures which are present behind the kidney, and that's why in the surgical approach to kidney, these three nerves are vulnerable to injury. Which three nerves? The subcostal nerve, the iliohypogastric nerve, and the ilioinguinal nerve. The subcostal, the iliohypogastric, and the ilioinguinal nerve, three nerves which I marked here, are vulnerable to injury while exploring the kidney from the posterior aspect. They are the posterior relations of the kidney here. Be careful, it's not lateral cutaneous nerve thigh, it's not genitofemoral nerve or any other nerve here. The three nerves here, the subcostal, iliohypogastric, and ilioinguinal nerve, are in the posterior relation of kidney. So this is about the identification of the nerve present on the posterior abdominal wall and forming the lumbar plexus and then going and supplying the lower limb.